They've been a lifeline. I've been coming for 2 or 3 years, heard about it through another activity that was going on, just came along to see, what it was all about, and just felt comfortable, felt welcomed, and just, gradually over time sort of eased myself into it. It's great that it's a drop-in, you don't have to be referred, you can just come as and when. It's not a course for so many weeks, so and knowing that it's ongoing as well, because in any recovery you have ups and downs.
We've had a person that came through the mental health drop-in, and she is now a tutor for the Learning Exchange. She started attending the mental health drop-in, where she was so nervous and shaking. It was a big thing for her to just come through the doors anyway. After a few weeks of attending, she then sort of looked at the Learning Exchange book and said, she might want to attend some of the groups and workshops that we were doing, so that's what she did. She then did our How to Be a Tutor course, and now she's delivering a workshop, and it's been amazing. She's supporting now other people that are coming through, and with her own journey she's been able to talk and tell people about the drop-in and how much it sort of gave her.
My name is Matt, and I'm one of the Community Mental Health Development Leads for Devon Mental Health Alliance. Our role is about supporting communities and the infrastructures around them so that those who need mental health support are able to get it.
So a Poverty Truth Commission brings together a group of people with lived experience. We call them community commissioners, and a group of civic leaders. They're called civic commissioners. And it starts from lived experience. So we worked with a group of community commissioners for 6 months. We took them to a public event. They shared their testimonies of experience of poverty with civic leaders, and then they chose the civic leaders that they want to work with. We formed a commission, and then over 12 months we worked together as a group to try and build an understanding of poverty, build an understanding of the system, and then go through a design process where we begin to design initiatives that tackle some of these issues that are going on. We're supported by Devon Mental Health Alliance, so a massive thank you. We had support in terms of a counsellor that supported us post-session. So if anything was brought up for people, they could go to that counsellor. And we also had Phil was invited as a guest, and amazingly, Devon Mental Health Alliance have given us some of Phil's time to continue this work. And without that, we wouldn't be able to continue properly.
The Plymouth Mental Health Collective brings everyone to the table. Grassroots community groups, frontline workers, larger organizations, and statutory services. Because mental health support works best when we work together, not in silos. With support from the Devon Mental Health Alliance, we are creating a space where collaboration is the norm, not the exception. A space that connects strategic thinking with frontline realities and helps people across the system, whatever their role, to know each other, learn from each other, and support one another. Whether you are running a peer-led project or shaping city-wide mental health policy, you have a place in this collective. Alongside the Devon Mental Health Alliance and the Trauma-Informed Plymouth Network, the Plymouth Mental Health Collective exists to drive change. We support capacity building through shared learning and professional development. We bring organizations together to leverage strengths and work towards shared goals. We create a space for sharing information, resources, funding opportunities, training, and expertise. And by working collectively, we increase visibility, helping organizations access greater support and funding. This is about working together, learning together, and building something stronger for everyone.
Over the last 12 months, we've established a Health and Wellbeing Alliance for Exeter and supported all the Health and Wellbeing Alliances across Eastern Devon in being funded, supported and heard by the local care partnership. Building off the momentum created by the locality implementation teams, we have developed a partnership group for anyone involved in providing mental health support across Eastern Devon for learning and collaboration. And we chair the Eastern Locality Leadership Forum that brings together Devon Mental Health Alliance, primary care and secondary care operational leads to drive forward place-based improvements. Through the trust we have nurtured, we have been privileged to be a part of numerous conversations and summits to work directly on the interface between primary care and secondary care colleagues. We have co-designed tools to help communities and organisations more deeply embed trauma-informed values, and tools to track the changes in relationships across the health and wellbeing sector in a place. We have supported the development of drop-ins across the patch through our relationships, presence, troubleshooting, and finding additional funds to support their sustainability. All of this work, and more, is to support the improvement of our community's integration, resilience, and capacity to meet the mental health needs of their populations.